Guys, what if I told you there's a specific spot on your body that when massaged for just 60 seconds can improve blood flow, reduce tension, and yes, help with those performance issues that snack up after 50? And before you click away thinking this is some weird alternative medicine thing, hear me out. This technique has been used in traditional medicine for centuries, and modern science is finally catching up to explain why it works. I'm Dr. Mariana, and I'm going to show you exactly where this spot is, how to massage it properly, which oils make it most effective, and why this simple technique could be the missing piece in your health routine. No expensive equipment, no awkward appointments, just something you can do in the privacy of your own home that actually makes a difference. Let's address the elephant in the room. After 50, things change down there. Blood flow isn't what it used to be, sensitivity decreases, and what used to happen automatically now takes effort, or worse, doesn't happen at all. Most guys just accept this as part of aging, maybe pop a pill when needed and hope for the best. But here's what's actually happening in your body. Your pelvic floor muscles, the ones that control everything from urination to erections, they get tight and weak at the same time. Sounds contradictory, right? They're chronically tensed but lack strength. It's like having a rubber band that's been stretched too long. It's tight but has no snap left. Your blood vessels in that region become less flexible. Circulation slows down, and the nerves that carry pleasure signals get compressed by tight muscles and poor posture. Years of sitting, stress, and just general aging create this perfect storm of problems. And because guys don't talk about this stuff, most men have no idea there's actually something simple they can do about it. The medical community is starting to recognize what Eastern medicine has known forever: that targeted massage and pressure point therapy can significantly improve pelvic health and circulation. Physical therapists now use these techniques for pelvic floor dysfunction. Urologists are recommending them for prostate health. But nobody's really talking about how this can help with potency and performance. The spot I'm talking about is called the perineum, or what some call the million-dollar point in traditional Chinese medicine. It's located between your scrotum and anus, right in the middle. I know, not the most comfortable area to discuss, but this spot is absolutely crucial for male health. This area is where multiple important structures converge. You've got major blood vessels that supply the penis, important nerves that control erection and sensation, the root of the penis itself, and connections to the prostate. When you massage this area, you're affecting all of these systems at once. Think of it like a traffic intersection that's gotten clogged over the years. Cars are backed up in all directions. Nothing's flowing properly. Massaging this point is like sending in a traffic cop to get things moving again. Blood starts flowing better, nerves get decompressed, muscles relax, and suddenly systems that haven't worked right in years start responding again. Finding this spot is easier than you might think. Sit on the edge of a chair or lie down with your knees bent. Using your index and middle fingers, press gently in the area between your scrotum and anus. You're looking for a slightly soft, indented area about halfway between the two. When you find it, you might notice it feels a bit tender or sensitive. That's normal and actually a sign you're in the right place. Now, here's the technique that works best. Using moderate pressure, about the same as you'd use to check a ripe tomato, make small circular motions. Clockwise for 30 seconds, then counterclockwise for 30 seconds. That's your basic 1-minute routine. You're not trying to dig in there hard. This isn't deep tissue massage. It's more about consistent, gentle pressure that encourages blood flow and releases tension. Some guys prefer an up and down motion instead of circles, kind of like gently bouncing on the spot with your fingers. Others do better with a press and release pattern, holding for 5 seconds, then releasing for 5 seconds. Try different approaches and see what feels most effective for you. The key is consistency and paying attention to your body's response. If you feel any sharp pain, you're pressing too hard. If you don't feel anything at all, you might need slightly more pressure, or you might be slightly off target. It takes most guys a few tries to get it right, so don't get frustrated if it feels awkward at first. Remember, this is a part of your body you've probably never paid attention to before. Now, while you can do this massage dry, using the right oil makes it significantly more effective and comfortable. The oil isn't just for lubrication. Certain oils have properties that enhance circulation, reduce inflammation, and even have mild hormone-supporting effects. Castor oil is my top recommendation, and here's why. Castor oil has this unique ability to penetrate deep into tissues, way deeper than most other oils. It's been used for centuries specifically for improving circulation and reducing inflammation. The ricinoleic acid in castor oil is a powerful anti-inflammatory that also stimulates blood flow. When you massage the perineum with castor oil, you're essentially giving that area a double treatment: the mechanical stimulation of massage plus the circulatory benefits of the oil itself. To use castor oil, warm about a teaspoon between your hands first. Cold oil on sensitive areas is not pleasant. The warmth also helps the oil penetrate better and makes the massage more comfortable. Many guys report a warming sensation after using castor oil, which is the increased blood flow you're feeling. Coconut oil is another excellent choice, especially if you have sensitive skin. It's naturally antibacterial, absorbs well, and doesn't leave you feeling greasy. Virgin coconut oil contains compounds that support hormone production and reduce inflammation. Plus, it smells better than castor oil, which some guys find a bit medicinal. Black seed oil is lesser known but incredibly powerful. It contains thymoquinone, a compound that's been shown to improve blood flow and support testosterone production. It's been used in Middle Eastern medicine for thousands of years, specifically for male vitality. The only downside is it's more expensive and can be harder to find, but many guys swear by it. For those who want to get fancy, you can create a blend. Mix equal parts castor oil and coconut oil. Then add a few drops of essential oils. Peppermint oil increases circulation and creates a cooling sensation that many find invigorating. Rosemary oil is another circulation booster. Sandalwood has been traditionally used for male reproductive health. Just remember, essential oils are potent. We're talking 3 to 4 drops per ounce of carrier oil, not more. Let me explain what's actually happening when you do this massage, because understanding the mechanism makes it easier to stick with the practice. When you apply pressure to the perineum, several things happen simultaneously. First, you're mechanically improving blood flow. The pressure and release pattern acts like a pump, helping move stagnant blood out and fresh blood in. This area tends to have poor circulation due to sitting and gravity, so this manual assistance makes a real difference. Fresh blood brings oxygen and nutrients while removing metabolic waste that's been building up. Second, you're stimulating nerve endings that connect directly to the erectile tissue. These nerves can become compressed or desensitized over time. Gentle massage helps decompress them and can actually improve nerve conduction. It's like cleaning the contacts on an old electronic device. Suddenly, the signal gets through clearly again. Third, you're affecting the prostate indirectly. The prostate sits just above this area, and massage here improves circulation to the prostate without direct internal stimulation. Better prostate health means better overall sexual function, improved hormone production, and fewer urinary issues. Fourth, you're releasing trigger points and muscle tension in the pelvic floor. These muscles can develop knots and areas of chronic tension, just like any other muscle. Releasing these trigger points improves overall pelvic floor function, which is crucial for erections, orgasm intensity, and bladder control. There's also a parasympathetic nervous system response. This massage activates your rest and digest nervous system, reducing stress hormones like cortisol that interfere with sexual function. Many guys report feeling more relaxed and centered after doing this massage, which makes sense from a neurological perspective. Timing matters more than you might think. The best time for this massage is either first thing in the morning or right before bed. Morning massage takes advantage of naturally higher testosterone levels and can improve energy and function throughout the day. Evening massage helps with relaxation and can improve nighttime erections and morning wood. For the first week, I recommend doing this every other day. You're introducing something new to sensitive tissues, and they need time to adapt. After that initial week, daily massage for 1 to 2 minutes is ideal. Some guys do it twice daily, morning and evening, but that's not necessary for most. Consistency is way more important than duration. 1 minute every day beats 10 minutes once a week. This is about retraining blood flow patterns and maintaining tissue health, which requires regular stimulation. Think of it like exercise. You wouldn't expect to get fit by working out intensely once a week. If you're planning intimacy, doing this massage about 2 to 3 hours beforehand can be helpful. It primes the system without overstimulating it. Some guys find that doing it immediately before intimate moments is too stimulating or distracting, so experiment with timing. During periods of high stress or if you're noticing more issues than usual, you can increase to twice daily. But if you experience any soreness or irritation, back off to every other day until things calm down. This isn't a more is better situation. It's about finding the right balance for your body. The biggest mistake guys make is being too aggressive. This isn't a deep tissue sports massage. You're working with delicate tissues and sensitive nerves. If you're sore the next day, you went too hard. If you feel bruised or uncomfortable, ease up. The right pressure should feel firm but comfortable, maybe slightly tender but never painful. Another mistake is giving up too quickly. Some guys try this for 3 days, don't notice dramatic changes, and quit. This technique works cumulatively. It's like going to the gym. You don't see muscles after one workout. Most men notice initial improvements in 1 to 2 weeks, with more significant changes after a month of consistent practice. Using the wrong oil or no oil at all is another common issue. Dry massage can cause irritation and doesn't provide the additional benefits of the oils. But using things like petroleum jelly or random lotions can clog pores and cause problems. Stick to natural oils that absorb well. Poor positioning is also common. If you're cramping your hand or straining to reach, you're not going to be consistent. Find a position that's comfortable, lying down with knees bent, standing with one foot on a stool, or sitting on the edge of a bed. Whatever allows easy access without strain. Some guys do this through clothing, which really limits effectiveness. You need skin-to-skin contact for the oil to work and to properly feel the tissue response. Yes, it requires some privacy and comfort with your own body, but the benefits are worth getting over any initial awkwardness. Beyond the obvious improvements in erectile function, men who do this regularly report a bunch of unexpected benefits. Better bladder control is a big one. That annoying dribbling after urination often improves or disappears entirely. Nighttime bathroom trips decrease for many men. Chronic pelvic pain, lower back pain, and hip tension often improve. The pelvic floor muscles connect to all these areas, so releasing tension here can have widespread effects. One patient told me his chronic hip pain of 5 years disappeared after 3 weeks of this massage. His physical therapist was amazed. Hemorrhoid symptoms often improve. Exercise performance, especially for activities like cycling or running, often improves. The pelvic floor is part of your core, and when it's functioning properly, your entire core works better. Guys report better stability, less fatigue, and improved recovery. Mental clarity and mood improvement are commonly reported. There's something about taking care of this neglected area that seems to improve overall well-being. Maybe it's the improved circulation, maybe it's the stress reduction, maybe it's just feeling proactive about health. Whatever the mechanism, guys consistently report feeling better overall. Deep breathing during the massage enhances the benefits. Breathe in for 4 counts, hold for 4, out for 4. This activates the parasympathetic nervous system and improves the relaxation response. Some guys find visualizing warmth and blood flow to the area during massage helps too. Hot and cold therapy can be helpful. A warm compress on the perineum for 5 minutes before massage helps relax the tissues and improve oil absorption. Some brave souls use cold therapy after massage to enhance circulation through contrast. A cold washcloth for 30 seconds can invigorate the area. Stretching the hip flexors and inner thighs before or after massage improves results. These muscles connect to the pelvic floor, and when they're tight, they pull on everything. Simple stretches like the butterfly stretch or happy baby pose can make a big difference. Staying hydrated is crucial. Good hydration improves blood flow and helps flush out metabolic waste released during massage. Aim for half your body weight in ounces of water daily, more if you're active or live in a hot climate. The key to making this work long-term is building it into your routine in a way that feels natural, not like a chore. Link it to something you already do daily, right after your shower, before brushing your teeth, or as part of your bedtime routine. Keep your oil in a convenient spot where you'll see it. Out of sight, out of mind is real. A small bottle in your nightstand or bathroom cabinet works well. Track your progress, at least initially. Use your phone notes or a simple journal. Rate your energy, any improvements in function, general well-being on a 1 to 10 scale. After a month, look back. Seeing progress motivates continued practice. Don't be perfectionist about it. If you miss a day, don't try to make up for it by doing extra the next day. Just get back on track. Consistency over time matters more than perfection. Even 3 to 4 times per week is beneficial, though daily is ideal. Consider this preventive maintenance, not just treatment. Even if things are working fine now, this practice can help maintain function as you age. It's much easier to maintain health than to restore it once it's gone. Here's what it comes down to. You have a choice. You can accept decline as inevitable, rely on pills with side effects, and hope for the best. Or you can spend 1 minute a day on a simple technique that improves circulation, reduces tension, and supports natural function. This isn't about miraculous overnight transformation. It's about giving your body the maintenance it needs to function properly. We change our car's oil, we clean our gutters, we service our appliances. Why wouldn't we maintain our own bodies, especially the parts that bring us pleasure and connection? The investment is minimal. A minute of time, a few dollars for good oil, and the willingness to try something different. The potential return is improved function, better overall health, and the confidence that comes from taking control of your well-being. So here's my challenge. Try this for 30 days. Every morning or evening, 1 minute of gentle massage with good oil. Pay attention to how you feel. Most men are surprised not just by the improvements in sexual function, but by the overall sense of well-being that comes from taking care of this neglected area. Sometimes the simplest solutions are the most effective. This ancient technique backed by modern understanding could be the missing piece in your health puzzle. If this information helped you, share it with someone who might benefit. These conversations need to happen more openly. Subscribe for more practical health advice that goes beyond the usual eat better and exercise recommendations. And drop a comment about your experience. If you try this technique, your story might encourage another man to take action. Your best years don't have to be behind you. With the right knowledge and simple practices, you can maintain and even improve function well into your later years. Remove these words.